you take by the police. So welcome. So it is 3 p.m. Eastern and we want to get started on time. So I'm just going to get us started and help walk through some tech tips. So first, my name is Pele. I'll be your tech host. If you do have any troubles today, feel free to private chat us hosts and panelists and we'll help you out as soon as we can. So again, welcome. Drop your name to the chat where you're coming from. Thank you for joining Attendance Works, the Institute for Educational Leadership and campaign partners for the 2024 Attendance Works campaign. Again, my name is Pele. If you have any questions about tech, feel free to drop it into the chat. Before we begin, I want to share some tips for you to engage. One, please use that chat box to share resources, to make comments, and access any resources that the speakers and panels will be sharing today. Two, to ask questions, drop those questions into the Q&A feature found on the black toolbar on the bottom. Three, please adjust your volume based off your own preferred settings. The quality of the audio is going to be based off of your own individual bandwidth. And then lastly, 4, we do have closed captioning. If you want to access that, just press on that closed captioning feature on that black toolbar on the bottom. When this webinar is over, you'll be receiving the recording link, the slides, and all resources mentioned within 72 hours. Lastly, I encourage you to tweet and share what you're learning by using the hashtag #SchoolEveryDay. Again, that's #SchoolEveryDay. Once again, thanks for joining today's webinar, Essential Partnerships for Showing Up Families, Youth, and Community. I'm now going to hand things over to Kwesi Rollins, Senior Vice President for Leadership and Engagement at the Institute for Educational Leadership and the Interim Director for the Coalition for Community Schools.
Good afternoon, everyone. Welcome, welcome, welcome to yet another wonderful webinar on a topic very important to us. You can go to the next slide. I'm Kwesi Rollins. I'm, among other things, the chair of the Attendance Works Advisory Board and really happy to be here with you. IEL, Institute for Educational Leadership, is celebrating its 60th year. And so we have been at it for a while. Working with and for leaders, developing, helping to transform communities, doing a range of things, Home for the Coalition for Community Schools, among other things, and really partnering with hundreds of communities around the country. Next slide. Attendance Works is probably the nation's leading voice on this issue of chronic absenteeism. We're very pleased, really delighted to have Hetty as our executive director, and the team at Attendance Works just does all of the right things to advance better policy, to nurture promising practice, and promote better communication and catalyze research on this issue, which is one of the top issues in education in our country today. Next slide. So we've got a great agenda, wonderful speakers. This is the second webinar in our series, Attendance Awareness Campaign, our key concepts. We'll go over reviewing right now. We'll look at the role of youth, essential partnerships for engagement and attendance. We're lucky to have Yoli Flores, Eric Fontanez, Jill Perea, and Annie Reed. Just a wonderful panel representing a breadth of perspectives on this issue. Next slide. Thanks so much again to our convening partners for this year's campaign for grade level reading, the Everyone Graduates Center, Future Ed, Healthy Schools Campaign, Mentor, National League of Cities, and United Way. You can find a full list of partners on our website, which is the URL is indicated in the slide, and you'll be sent that later as well. Next slide. Our slogan for 2024, which is a great slogan for every year: be present, be powerful. Next. So as I mentioned, this is the second webinar in the series. If you haven't seen the first webinar, you can go to the Attendance Works website and see a recording of webinar number 1. You can register for all the webinars in this series. And in fact, you can see previous webinars in previous campaign years as well on the Attendance Works website. This session, along with all sessions, will be recorded and sent out to everyone who registered. So you will have access to it. That's usually one of the first questions that's asked in a webinar as well. Next slide. Key messages for be present, be powerful. We've got to ensure that students get to school and that school provides opportunities for them to progress academically, develop socially, and reach their dreams. Trusting relationships seems to be the key to everything. There's no way we can achieve most of our goals without building trust and maintaining and sustaining trust. Supporting the health and well-being of students, families, and school staff improves attendance. And obviously, all hands on deck. We've all got to play our role. We've all got to be a part of positive problem-solving approaches driven by data to improve attendance. Next slide. Special thanks to our corporate sponsors for this webinar, Kaiser Permanente and Rawi K-12 Attendance Improvement. Next slide. And please consider becoming a monthly sustainer or otherwise supporting Attendance Works, part of how we're able to present these webinars and to present all of the resources and supports that Attendance Works provides for free is through ongoing donations. So don't be shy, donate today, hit the button. And with that, I'll turn it over to our esteemed and already smiling executive director and founder, Hetty Chang, and one of my many partners in crime.
Well, thank you, Kwesi. Such a pleasure to be here with you and with Kwesi, who always helps make our work feel grounded and real. Next slide. Just quick reminder, you know, when we think about terms, we're talking about this issue of chronic absence, which is missing 10%, including all absences. We look at that chronic absence differently from average daily attendance, which tends to look at how many kids show up every day, but that, and it can give you some key insights about particular times of the year, particular days that are challenging, but it masks chronic absence. This is different from truancy, which only looks at unexcused absences, or kind of much more emphasizing compliance, and often we'll start going into legal, more typically blaming solutions. So these two terms are ones that have been around a lot longer than chronic absence, which has now been really in use for just about a decade, but not much longer. And this is looking at emphasizing the impact of missed days and how then you don't get the benefits of being present, which can be about routines, engagement, access to resources, not just the negative impact on learning. And well, when you miss school, you're getting that negative impact on learning. And this is really about emphasizing a prevention-oriented problem-solving approach that starts with cultivating family and student engagement, because we know when you start with punitive action, often you miss the opportunity to connect and engage with families, so you can really find out what's going on and build those relationships that are so essential to coming to school. Next slide. You know, we are seeing that chronic absence went up to almost 30%. It's probably dropped 2 or 3% for 22-23 given state data. But so we still have a huge issue. And while we might be seeing some declines, I think in the current year, based on what we're seeing, we know this is a challenge that we're nowhere near where we were pre-pandemic. Getting where we want to be is going to take intentional persistence and commitment over time. Next slide. And one of the things that we have to really keep in mind is that we have to get back to this culture of attendance every day, because the ripple effects of the high levels of chronic absence that we experience right now are just so challenging. By 21-22, you had 2/3 of kids in a school were 20% or more of the kids were chronically absent. And at that point, it's harder for teachers to teach, teachers to set classroom norms. Kids, actually, we know that when chronic absence is at a high level, it can actually make it more likely for kids to be chronically absent subsequent days, in addition to affecting their academic achievement. And we have to act together as a whole community, as a whole country, to be able to make sure that we get kids back into this routine of attendance every day. Next slide. And these high levels of chronic absence really reflect an erosion in these positive conditions for learning that we are still trying to put back in place since the onset of the pandemic, making sure kids feel physically, emotionally healthy and safe, that sense of belonging, connection, support, knowing that what's happening in school is academically engaging and challenging, and that we're not just investing in kids, but we're investing in the adults in schools so that they have the capacity to engage in that relationship that we know is so essential to all of these positive conditions for learning. If you go to the next slide. And again, the key is not punitive approaches, but finding out and addressing what causes students to miss so much school. What are these are barriers? Some that might have been increased during the pandemic or exacerbated. One of them are aversions, like kids feeling anxiety, social and peer challenges. What is it about disengagement? And we know relationship building has been challenging, especially with staff shortages. What is it about misconceptions? Like the misconception, we already had challenges even before the pandemic that kids didn't realize how many days they missed. But now you have challenges where maybe folks think, oh, I don't have to show up in person. I can just make up for it remotely, without recognizing how being in school gives you a different way of learning and connecting and socialization that is still crucial. As well as one of the challenges from the pandemic has been people are still confused about whether when they should show up to school, when they might see a symptom of illness. And this is why it's so important to have an all hands on deck to both unpacking and addressing these issues. And one thing we do want to mention, if you go to the next slide, is that it's really important to hear a little bit from our young people about what's challenging and what works. And we're going to start off with Isaiah, who is a young student, high school student, who the Children's Aid Society has worked with. So let's hear from Isaiah.
So what happened in 8th grade going into 9th grade was the pandemic and COVID-19. And when I caught it, I stopped going to school. My attendance rate in my freshman year was 21%. The most important people that helped me was the social workers and the guidance counselors, because they helped me mentally and they would always check up on me and they would just motivate me and inspire me to come to school every day. My attendance rate this year is 92%.
And I actually had the pleasure of meeting Isaiah this morning at the White House, because there was a big event today where part of what we did was we had Isaiah and his mom talk about the challenges they faced a little bit, but also the importance of having someone there, the people in schools, the Children's Aid Society, who had worked with him over time and had that relationships to provide the supports. So when things got tough, Isaiah had the help to show up back to school. So let's go to the next slide. I think what this really shows is we need this multi-tiered system of support that begins with prevention, starts with those foundational supports that we talked about, universal prevention. And then when you see signs that kids need more, there are people equipped to provide early intervention or intensive intervention so that we can get all our kids back to school. And if you go to the next slide, what we know is that this is going to require the entire community. Levels are so high right now. This isn't about what one person can do alone. It's about what we can do together. It can be about what students and families can do. In today's meeting that I was at, there was a young person who was a high school student who was actually a peer mentor. So students and families can both talk about what the challenges are. They can also be resources to each other and supports for getting kids back to school. It's about involving all school staff. It's not just one social worker who's going to be able to help build that culture of attendance that gets everyone excited about showing up every day. It's about the entire school staff and making sure every kid is connected to a relationship. And then it's about engaging external partners, because some of the challenges we face are just beyond what schools alone can address. This is about all hands on deck. Next slide. And the bigger the size of the challenge, and our challenge is still quite big, more than a quarter of all our kids. And in some communities, it might be even a third or half their kids. The greater the size of the challenge, the more partners that you'll need, whether that's businesses or community schools initiatives, family support organizations, early child providers, faith-based organizations, health, mental health, housing agencies. You know, the list goes on. And it's really important for everyone to be able to take stock of who's in your community and figure out how you can engage them. And if you go to the next slide, one of the ways you can think about taking stock is if you can find out from young people and families and staff and all the people have insights into what are the challenges kids are facing and families are facing, you can find out more about what are the challenges, what are the reasons they're absent. Then that gives you clues about what interventions you might need. And then you can think about, well, so what are the partnerships we need to offer that and offer that at the scale needed, given how big and how many kids we think are facing that particular challenge. Next slide. So this is about taking a systemic approach. We have to have actionable data, start with positive engagement, use and deploy these strategic partnerships, make sure that the schools and communities, the populations that have the greatest challenges get even more resources. This is about shared accountability and responsibility, and then building the capacity of all of us to do this. And this is going to require every district and every community working together to make sure that this systemic approach exists. So it is my pleasure then to bring us to a panel who can help us think about how do we do this and how do we engage in those strategic partnerships that really make this possible. We are going to be joined by Yoli Flores, longtime friend and partner, the CEO and president of Families in Schools in California. Some of you might know Yoli from all her prior roles as a school board member or at the Campaign for Grade Level Reading, and now bringing her wisdom to really think about these family engagement partnerships. We'll also be joined by Eric Fontanez, who's the supervisor of equity initiatives in Bethlehem Area School District. And Eric has done every role possible in a school, right? From teacher to principal to administrator, and now he's in the district helping to move things forward in partnership with one of their great partners, who's Jill Pereira, who is the vice president of strategic partnerships with United Way of Greater Lehigh Valley. And Jill has just been watching her for the past decade, mobilize folks in her community, make sure her United Way takes a strategic approach and integrates this work into all the work they're doing in their community and in partnership with their school districts has been amazing. And last but not least, we're joined by Annie Reed, who's the executive director of Thriving Schools at Kaiser Permanente. Annie has worked in schools. She was in the Chicago Public Schools working on health and wellness. She's worked with Attendance Works, and she is really leading the work nationally as Kaiser Permanente thinks about, as a health provider, as a health insurance, how do they partner with districts and schools to ensure the health and well-being of their students? So with that, we are going to go to our first question for our panelists. This is going to be an interactive dialogue. And I am going to ask Yoli to start off and talk about what do you see, and you can give a little background on how you see this too and what perspective you're coming from, but what do you see as the top two drivers of the continued high levels of chronic absenteeism? And if you can, put a little bit of spin about how this was affected particularly by the pandemic. What are the drivers, and maybe a little bit about what's unusual or new as a result of the pandemic and what you think would help to address them. So Yoli.
Great. Thank you, Hetty. It's great to be with you again. And thank you to all the participants who are joining us, knowing that this is such a critical issue for all of us to solve together. So I'm Yoli Flores with Families in Schools. Our mission is to ensure student success by building authentic partnerships between families, educators, and system leaders, and through parent-led advocacy. And one of our top goals this year, actually for the next several years, is really to address the early literacy crisis in Los Angeles and in California. And as we began really establishing our work plan around how we would end the literacy crisis, obviously a key issue is addressing chronic absence, particularly in the kindergarten years. So I'm going to share the top few barriers from that lens of our focus on the early years, because the barriers differ a bit between younger kids and older kids. And so in partnership with Attendance Works and with the Parent Institute for Quality Education, or PIQUE, we have been leading a series of focus groups to really understand from families directly, not making assumptions, for the high levels of chronic absence in kindergarten, which have been off the charts in California, probably the same everywhere else. In 22-23, that was 42% for all kindergartners. So what we're learning, and we're not finished yet with our work, but what we're learning as we're talking directly with families about some of those really core issues and root problems around high levels of chronic absence in those early years range. I have a list of things, but I'm only going to give you three as asked by Hetty. So one is that there is still a lack of clear communication. Families are quite confused about what now constitutes chronic absence. And that obviously, has reverted back to pre-pandemic with the messages now being around coming to school if it's, a sniffle or a tummy ache that maybe is related to anxiety. But their families are not getting that kind of consistent message. They're still sensing that if it is a sniffle, they should stay home. So there is a need for clear communication on attendance policies and more frequent communications. Families are saying to us, we get a little bit of information at the beginning of the year about the importance of coming to school every day, and then it just drops off. So both clarity and consistency on what constitutes chronic absence and the importance of being in school every day. Families are also reporting that absences related to illnesses are excused absences and therefore doesn't count under the chronic absence category. So we have more to do to help families understand both the meaning of chronic absence and the impact of chronic absence. The second barrier for little kids is around the challenges related to transitions from being at home if they didn't have preschool or preschool to kindergarten. The abrupt schedule changes for kids, for children, including earlier start times, but also more punitive tardy practices, some difficulties with morning drop-off, and then concerns about children's reactions and adjustments to new routines. Those are contributing to chronic absence issues. What was striking is a theme that's come up around social and emotional issues. And families are sharing that the social emotional impact on children entering kindergarten was actually mentioned a lot more frequently than the academic impact when considering what happens when your child is absent. And then the third, and I'll turn it back to you after this, Hetty, are some concerns around student-teacher relationships. So several parents mentioned instances where children don't want to attend school because there are issues with their teacher, including teachers being too strict, screaming at students, or not showing patience. So this strained relationship is resulting in children not wanting to go to school. So we think sometimes, or we assume that the social emotional issues are external, right? Issues inside the home, poverty related, etc. But some of these are happening in school for little kids. So lots to think about here as we think about how we're going to end the chronic absence crisis that we have.
Yeah, that's really helpful, Yoli. It sounds like this issue of, do I really need to be in school every day? And how do I think about some of these social emotional transition challenges and developing those relationships, which if you don't realize you need to be in school every day to actually get through them, might mean that you keep them home and it gets worse.
That's right. That's right. And, you know, as we do our work around early literacy, we're trying to convey to families that the learning starts in kindergarten. And so there's a little bit still of a misperception as well on what really happens in kindergarten every day for families to really begin to understand that real learning is happening and missing school has an impact. But then families are going to have to weigh like the social emotional well-being of my child or the importance of the academics in school.
Thank you so much. I'm going to ask Eric to join us. So Yoli talked some about the challenges with our youngest learners. And while I know that that's maybe something you also see, Eric, you also are working with middle and high school kids. What do you see as some of the biggest barriers? And I'm also going to say, just before I turn to you on that, mention that in the Q&A, you all can also add in thoughts about what you're seeing as the barriers that you're seeing in your communities. Maybe they're ones that our speakers are speaking about, or maybe there are ones that are unique to your community. But Eric, what are you seeing as some of the biggest challenges for our older students?
All right, thank you, Hetty, and thank you to all the participants for taking the time out of your busy days to really discuss such an important topic. Attendance is always at the forefront of everything that we're doing, and as a former principal, currently the supervisor of equity initiatives, he kind of mentioned, I work with pre-K all the way up to 12th grade in our 22 schools, and the best equity work that we could do, right, is the education that we offer to all students across our district. So one of the things that we look for is barriers that stand in the way for the students, for our families, and the best ways to reach out to them to get that messaging. So I know you only mentioned, some of that communication, and even in our middle schools and high schools, we're seeing that as well. The lines really became blurred on what chronic illness is. During COVID, if they had a cough or a sniffle, we would tell them, yeah, stay home, stay home. Families started to adapt to that messaging. Students who were in that higher end of elementary, that 4th and 5th grade, by the time they moved on to middle school, that's just what they got used to, right? Like, oh no, I might not feel good. I'm not going to school. So later on, as we talk about some other questions, I'm going to share, some of the ways that we try to build upon that and work with our partners in order to try to get that messaging out. But one of the drivers that I do want to talk about as well is the school climate and the engagement especially for our middle school and high school students. After COVID, a lot of student connections and engagement was lost. And I'm talking about, of course, the connections with the staff and maybe those people that really made you feel safe every day, but also those connections that we had even with our own classmates. The pandemic kept people alone, and when you weren't around each other, you were basically looking at a screen in order to communicate with each other. And we have seen the difference with adults in the workplace who've suffered after COVID, and it's a bigger effect on our students. Our students have lost social skills. They don't know exactly how to get through disagreements when you're seeing things differently, how to work together, and most importantly, how to build those relationships in person. So what it does is it starts to create a negative and unengaging environment where students, it deters their regular attendance. They don't want to be there because they're not finding that place where they have that sense of belonging and where they feel comfortable and want to be there. So we have to find those ways to really get around that.
Hey, Eric, before we go on to the next person, there are a couple of different comments about tardiness here. How is tardiness playing out in your what you see, and again, and maybe it's connected to engagement. I hear for middle and high school, there's tardiness, and then they come to school, but then they're skipping a class period. So where does that play into some of the barriers that you're seeing?
When I put my principal hat back on, I remember the messaging that I would always give. When someone walked through the door, how do we engage them into that school immediately? So is the first words that you're saying when they walk through the door like, "Oh, you're late"? That immediately would will change a student's day by that one comment. So we were very big and always giving that message of like, when they walk in, we'll have the conversation about being tardy and being on time, but maybe that's not the first thing we need to talk about when they walk in. So when they come in, it's more like, hey, thanks for being here. We're so glad you're here, you know, and really starting that positive atmosphere. Because, you know, when we talk about relationships and when we talk about engagement, it doesn't always have to be that classroom teacher, right? It could be that first person you see when you walk into the office. It could be a custodian who's working in the school. It could be anyone who's in that building. Can really build those relationships to have that check-in person, to make students want to be at school, you know, and to have them there on time. One of the areas that we look at too, even when we look at barriers, is even some of our transportation, because, you know, being in Northeast Pennsylvania, you know, we get our snow days and we get our cold, rainy weather. And some of our students do have to walk, you know, pretty far to school. And when it's cold and rainy, we see our attendance rates really drop. So, or rise, I guess you can say, right? So what can we do to try to help with those barriers that are in the way if parents don't have vehicles or if students can't get transportation to school?
Thank you so much. Jill, you're a partner with Bethlehem and many other schools in your area. Tell us, what are you seeing across some of the places you're working as some of the top drivers?
Yeah, thanks, Hetty. So happy to be here. I'll just frame this out a little bit from a United Way perspective to say, you know, for other kind of regional entities that might be listening, we really kind of start from this place of envisioning communities where every person belongs and thrives. And then the belief that an educated populace is really necessary as the foundation for a thriving community. So our big push then is around investing in strategies that will bolster that thriving community. We're particularly invested in community schools and in a lot of the work around the campaign for grade level reading. So chronic absenteeism situates as really key focal areas under both of those pieces. We cover a 3-county footprint with 22 school districts. And so what we have just, you know, to tap on to some of things Eric said and also Yoli, the world is not the same place that it was post-COVID as it was before. We're still emerging from that cocooning that happened for those couple of years. And there's been a real shift in how people value their time and their safety. And so it is more important than ever that schools are finding ways to reassure communities that they are safe places, that value people and relationships, as much as high quality instruction and relevant world experience. And so I think both Eric and Yoli kind of pinged in on, it's really important for us to note that teachers experience the COVID pandemic too, and have their own stressors and anxieties about that. And we're trying to emerge back into this space of kind of shared healing, if you will, as a community. So I think that's one thing. The other, which has also been touched on, is there's been a bit of a default to the convenience of virtual learning. And we have loosened the expectation of simply showing up physically and also mentally, that's important to the learning experience and adds tremendous value. And then third, I would say the same barriers that existed before COVID happened are still here. And many of them have been, they've gotten much, much worse. So I think Eric pinged in on the transportation. Certainly mental health has ballooned as an issue we'll talk about, I'm sure, as we move forward here, but also all of the economic barriers that existed pre-COVID have been heightened. The affordability of safe and affordable childcare, safe and affordable housing, budgets tightening, prices going up. So those are the things that we're kind of seeing across the region that are likely reflected in other communities.
Thank you. So helpful. And Annie, last but not least, I want to have you come in and join and add to this. What are you seeing as some of these barriers, particularly because you're coming in from a mental health perspective as one of our health providers?
Yeah, thanks, Hetty, and really appreciate the opportunity to be here. And just to give you all an idea, if you're not familiar with Kaiser Permanente, we're the largest integrated healthcare system in the country. And we cover and care for almost 13 million members in 8 regions nationwide. So as an integrated system, we really care about the health of our communities because that's where our members live, work, and play. And in fact, that's why we started Thriving Schools at Kaiser Permanente, which is really an initiative that demonstrates our commitment to ensuring that not just students, but also teachers and staff have healthy environments where they can learn and thrive. And obviously, I think, I'm here because we see the connection between health and education, and I'm sure that's true of many of you today. I've seen a lot of shout outs to all the school nurses and other health related folks on the call. So glad that you're all here. And we really think that health is a critical input to the outcomes that schools are driving towards. And one of those is absenteeism or attendance, maybe on the flip side. And even so, health issues might not always be the first cause that we think about, or maybe the root cause that we think about. But I just want to maybe do a quick storytelling because a lot of folks may not know that actually the field of school health was born out of a pink eye epidemic in New York City, where the first school nurse was hired. And I think, the district had been trying this is where I know only enough to be dangerous, but had been trying for several years, from what I remember, to curb this pink eye epidemic that was keeping kids out of school. And they hired these school nurses, and in just a matter of months, they saw a decrease of pink eye and an increase in attendance. So really, there is a marriage between health in schools and attendance, which of course leads to all the outcomes that you were talking about earlier, Hetty. And even so, we see, and this is actually true, we were with a district just a couple of weeks ago, who hadn't really been looking at the causes of absenteeism, and what they learned was that illness was by far the leading cause of absenteeism for the students in that district. And in fact, students were 1.5 times more likely to miss school due to illness than all the other reasons combined. And of course, this is self-reported. It's not perfect, but I think it's just a reminder that we have to attend to the different dimensions of health in schools to ensure that we're really supporting our attendance. So that's why we take this foundational approach to the physical, mental, and social health issues that are playing out in schools through our Thriving Schools approach.
And Annie, when you say, well, and I was just saying, when you say illness, though, that is a code for lots of things. I'm just thinking sometimes kids who are having anxious, they have a stomach ache, they have a headache. Illness isn't always a physical illness. It actually can be related to those other mental health related issues.
Yes, thank you, Hetty. It's not, as I was saying, it's not a perfect representation, but that was a great tee up to what I think is definitely the number one driver that we're seeing in our work, which is youth mental health. To your point, Hetty, we're obviously in the midst of an unprecedented youth mental health crisis. The Surgeon General deemed it, the most pressing public health crisis of our time back in 2021. And we're seeing unprecedented rates of depression and isolation among our youth population. So I think to try to extract the youth mental health crisis that we're in from the attendance crisis is a mistake, and we really need to think about how these two things are interrelated. Because we know that, when folks have anxiety disorders or depression or other mental health challenges, it can be really overwhelming and challenging to get to school, stay in school, and then continue to be engaged in classroom activities. The other thing I just wanted to call out is also, and I've heard a couple of other folks mention it, but I think it's not getting enough airtime, is really this question around staff and teacher well-being. And I mean enough airtime sort of in the narrative in general, not here today. I think we're planning to give it a lot of airtime. So, we know that that teachers were stressed out before the pandemic. We've known that for a long time, and we were seeing increasing rates of attrition and people leaving the field, but that has just skyrocketed since the pandemic. And so I would say, it's going to be really hard for, all the solutions, all the strategies, all the interventions that we've been talking about. If teachers and staff aren't feeling like they belong, like they are seen, like they're valued for what they do and what they bring to their jobs every day, then it's going to be harder for them to provide the support that we need students to receive in order to come to school every day. So I think, it's great to focus on the teachers and staff just on their own, because that's such an important population for the outcomes that we're looking for their satisfaction and retention in schools, but also, of course, to support with absenteeism. And before I end, I just want to make sure I'm really clear that I'm not suggesting a punitive approach here. I've seen in the chat, we do not want kids to come to school when they're truly sick. We don't want to punish parents or blame teachers if they're not at school. What we want to do is really focus on creating supportive, healthy environments to make school a place that people want to be.
Thank you, Annie. And I'll just weave a little thing. I saw someone put something in the Q&A about a mental health day does not count for excused absences. And I just want to say there's a lot of policies. What counts as excused and unexcused varies totally by state and sometimes by locality. There are a growing number of states that are saying you can count a mental health day as an excused, not an unexcused absence. But I think, Annie, given you're talking about that mental health is a huge issue, even if it's excused, it's a challenge if kids are missing too many days for mental health issues. And we ought to be noticing and monitoring that, because it might mean that we actually have to invest more in mental health intervention. So I just wanted to bring that up as we're talking about it. And I know we're not done with talking about mental health. So I would love then to shift, and we're going to start back in with Yoli. What are some great examples of where you've seen partnerships make a difference? And I also will invite people to offer up examples of partnership in the chat if they have them in their community. So Yoli, tell us about where has partnership made a difference around, especially with our youngest learners?
So I think the audience knows I'm from Los Angeles, California, and pay a lot of attention. We're a key partner to the school district here, the Los Angeles Unified School District. And what is making a huge difference here are home visits, direct home visits by the superintendent himself. He and his team have made 23,000 visits to families, have knocked on 23,000 doors in the last year and a half. And he wanted to learn directly, he listened himself to the families, to the students on what these challenges and barriers were, why they were not in school every day. As a result, chronic absence at LA Unified has dropped from 45% in 21-22 to 28% in 23-24. That is a significant, I think that's actually a little lower than the national, which is about 29 or something percent from the chart that you shared earlier. And the superintendent has understood that he cannot solve this problem alone. So in addition, he has convened a roundtable of leaders in Los Angeles with all of those different players that you named earlier, you and Kwesi named earlier, and invited us all to step into our leadership roles, our organizational missions, to help address the problem. So he has seen this as a citywide movement. We are all responsible. We all have to chip in and figure this out together. So I would say, really do not underestimate the power of your leader talking to families directly, but also embracing an entire ecosystem in your community to be part of the solution. I'm going to drop in the chat a interview with the superintendent. It's Alberto Carvalho, and a story in the LA School Report, so that you can learn a little bit more about the strategies and hear from him directly how he has been listening to families. One of the results is he listened to families, and a key theme had been transportation, and this has come up a lot. We now have free transportation for any student in Los Angeles. Regardless of where you live, he wanted to remove that barrier. Sometimes it's because our families don't have cars, or maybe they just have one car. Somebody in the chat wrote about that. Or kids are afraid to walk to school. or all, whatever number of reasons, we have at least closed the door on that problem. There is now transportation for every student.
Thank you, Yoli. What great examples. Eric.
Yep. Just one
Okay.
other, just last thing, because this has come up consistently, is a lot of focus on mental health supports and greater support for teachers around mental health supports as well. So there's a real embrace on this is real. And it's yes, COVID related, but it goes even beyond COVID. There are lots of reasons where our young people are struggling emotionally or have mental health issues. This thing is problematic. Is actually increasing the number of suicides of young people because of all the social media nonsense. So we've really embraced the focus on mental health, and I see that becoming a high priority, or staying a high priority in Los Angeles.
Thank you, Yoli. Eric, what partnerships have helped in your schools, in your community?
So as someone who is always a principal in community schools, and who still in my role oversees our community schools from the district level, I definitely want to talk about the whole idea of community schools, right? It's to create a hub in the community where children can be successful in their educational career. And how do we do this? We find the barriers that are standing in their way, and we find ways to support that. Of course, attendance is one of them that comes up. So, we have our monthly core team meetings where we meet with our lead partners who are there. United Way is sitting at the table, district representation, which is usually, myself. I'm sitting there, and we brainstorm ideas and ways to engage our students, ways to support the families, and we bring up any needs, right? And it could be something that's a big issue, anything down to, what, the students tardy all the time because they don't have an alarm clock. All right, well then, how do we get them an alarm clock? We work together in order to beat those barriers. We also partner with some local health clinics to offer in-school health services. So that's what that way our school is our true one-stop shop. For example, we integrate mental health services. We do regular health screenings. And that can all help to reduce absenteeism. By having everything right there in the building. We've brought in local organizations to provide mental health services in the school. So this way, it's not an additional place that the family would have to find or transport their child to. We have it right here in the building. We've used local small businesses that have come in. They've done affinity groups, kind of like your ERGs, but in affinity groups for our students. We've done that. They come in, they do parent workshops. And some of the focus is that when they come in and they do their parent workshops is on attendance. So we'll have them come in and they hear from someone else, not just from the school all the time. We have our local healthcare providers who are a part of the school. Not only do they provide some services in-house, but they're a part of the community. If we're having a parent and family engagement event, they come and they set up a table so that way they can build those relationships with the families. And then finally, one of the last things, we also have a great partnership with a local organization called Kellen Foundation, and they come in and they do lessons for the kids on like healthy eating and healthy lifestyle. And then we'll also bring them back. They do presentations for the parents, and they do things as cool as bringing out like a food truck, a mobile food market, where they set up in front of some of our needier schools. And they sell fruits and vegetables and healthy foods. But what's great about it is they also work by taking coupons, by taking like any of their SNAP coupons and they actually give them more for what they get. So if you have $10, they'll give you $20 worth of food. So that's been a great partnership to really, just to try to teach about being healthy and then, working attendance into it.
Boy, Eric, that's so helpful. And it really speaks to the whole child, whole community approach, because it's starting with making sure kids stay healthy and are healthy and then don't get sick. Mm-hmm. So, Jill, what would you add to the kinds of partnership we're seeing in Lehigh Valley?
Yeah, our community school network is just doing some really amazing things. And we have lots of good work happening, particularly in Bethlehem, but in the other 4 districts as well. Data is the name of the game in terms of partnerships. I see a lot of chats, a lot of notes in the chat where folks are either having their hands around data and are looking for what to do next, or are trying to solve the problem and haven't yet gotten to the data. The data has been really key for us in understanding what are all of the challenges, and then how do you go and build partnerships in community for addressing each of those challenges. There's also been a doubling down on relationships. And so, we assume positive intent. I think when we start talking about bringing young people and family voice into the conversation, people tend to have one of two responses. One is, yes, we are welcoming of youth and family voice as people of their own decision makers, and they're a huge part of the solution. And others who haven't gotten there yet, that are maybe not quite so open and are nervous about the can of worms that might open. It's totally worth it. So I'm going to queue up here a partnership that we developed. It actually developed out of our community school work pre-COVID, when we were working with schools to understand. Some of it was around chronic absence and success in schools, and recognizing that culture was a bit of an issue in some of the schools. And a lot of that was driven from teacher expectation about what students could or couldn't achieve based on the vitality of the community in which the school was placed. And so out of our community school work grew Resiliently High Valley. It's an initiative that's related to building hope and healing to get to resilience. And so through the pandemic, we started talking with young people directly. And some of the feedback we got, particularly then around mental health, was our parents don't know how to talk to us. Our adults in our life don't know how to listen to us. We're not getting the support that we need. And the request that came to us was, could you please do some outreach, a set of PSAs, some videos to help us as young people help our adults in our lives understand how to better support us. And so with that, I'll queue up this video that helps to share, one of those PSAs, but really the broader scale here is youth voice is really important, and so is family voice in how we solution forward.
The Surgeon General has described the declining mental health among youth as the crisis of our time.
When you keep telling me I'm fine, it isn't helpful.
I've been faking it when you ask me if I'm okay.
The pressure that I put on myself, it just feels so overwhelming.
At Our United Way, we have a strong commitment to serving students and families. Our programming reaches 45,000 students and families annually. And through Resilient Lehigh Valley, we are dedicated to increasing youth resiliency. We held a Greater Lehigh Valley Youth Mental Health Summit and listened to over 200 students in our region share their thoughts, ideas, and needs. What we learned is that students in our region are suffering.
I just want you to know that depression is real, and it's not a choice.
Just because I'm young, it doesn't mean I don't know anything.
We are launching a new campaign called Youth Speak Up Lehigh Valley. The initiative is designed to bring youth voice and youth-led solutions to the growing mental health crisis.
I need you to listen to me, not talk to me.
When you simply take the time and look at me in the eye and tell me everything's going to be okay, then I know I will be okay.
43% of Lehigh Valley teens reported feeling depressed most days, and 20% reported having suicidal thoughts. We want youth, teens, parents, and families to feel seen, heard, understood, and supported. We hope this effort helps youth and families better understand each other and to communicate. No one is alone, and help is available.
I can't get through this by myself.
I just wish you'd listen.
Thank you for just telling me it's okay.
For more information, please visit resilientlehighvalley.org.
So Hetty, I think the note I'm trying to underscore here is we're talking about how do we get our young people to show up every day in school to learn. And we are also recognizing our young people are dealing with a lot of issues, right, that are challenging for them perhaps to deal with on their own. And we all need to be on the same team. We all need to be on the same page to be able to figure out how to bring all of the resources to bear for not just kids, but families and educators, and to make it all move forward.
When I see in this partnership, Jill, it's multifaceted. It's having youth and be partners in identifying the challenge and the solutions, but United Way being a partner in helping publicize and then even engage other folks so the community is on that same page together.
Yeah, that's exactly right. We partnered city government, school districts, youth and family serving providers. We actually have the 3rd annual conference coming up next week, where we were aiming at having youth participants. We will have youth participants in person. And so this hasn't been easy for us. I think as an organization that has traditional roots in how we do things, we're leaning into our own principle of agility and saying, like, we need to be responsive to community, and young people and families are part of that. And so I think when you're open to learning and continuous improvement and shifting in order to meet the need that exists in the community, some really powerful things can happen that might not be and typically aren't the same old.
Yeah, well, and it's breaking through different silos, because we might not have thought of the mental health as the attendance strategy when in fact those two things are so integrated. With that, Annie, I want to have you come up and talk about some of the partnerships that you've seen really work.
Yeah, that was such a powerful video, and so nice to hear from students about what the challenges that they're facing. And I love this question, Hetty, because I think we are all here because we know that schools cannot face this challenge alone. And it takes really this cross-sector partnership to do the work. And that's why, at Kaiser Permanente, we've been working closely with school partners across the country, including in our own footprint, to really look at student health outcomes and as well as staff and teachers, which includes health and attendance. So I want to talk quickly about 2 examples of partnerships. One is actually about how we're partnering as a health system to provide resources to school districts. And then secondly, an example about what health systems can do to support school districts from where, through their own sort of operating models. So the first is I just want to lift up that at KP, we have a resource, an initiative called Resilience in School Environments, or RISE, which is all about resilience building in school environments. And it's focused on cultivating practices that strengthen resilience of school employees, including teachers and staff, as well as students. And this is an initiative that we do in collaboration with Alliance for a Healthier Generation, and thousands of schools across the country are engaged in this work. And we have seen, I want to go back to Hetty, what you said earlier about mental health. Not everything that we do around mental health, especially in schools, needs to be tier 3, right? It really, what schools are so good at and where we can really focus our time and energy is at that tier 1 and tier 2 level. And that's exactly what RISE is and where we've seen results. Not every student needs counseling. That's not always the appropriate intervention. And there's a lot we can do to sort of do prevention and early intervention. So what we've seen with RISE through our evaluation is that when schools and districts have implemented it, we've seen increases in job satisfaction among teachers and staff, improved connectedness and engagement with the school community between students and teachers and staff as well. So that's one example. And we know obviously that given the conversation we've been having so far, that we believe those outcomes will also strengthen attendance at the schools and districts that are participating. The other partnership I want to really call out is sort of more around explicitly partnership with healthcare. And I think there has been there's a real opportunity that we haven't fully availed ourselves of, and I would say this is true of us at KP as well, is that there's a lot of ways that as trusted messengers, pediatricians especially, can support messaging around the importance of school attendance when they see students. And an example I'll provide is actually comes from our Northwest region, which is in Oregon. And it seems very simple, but in fact, it took a long time to do it. But it's something that we, are thinking about a lot is how the Northwest Medical Group included a question about student attendance on their pediatric intake form. And what a simple and great way to start a conversation and a signal to a family the importance of the student being in school every day. And we also think there's a lot of ripe opportunity around data and how we can better use data about health to inform education and vice versa, use education data to inform our healthcare providers. I would take all day with that. And I know we don't have time for that, so I will leave it there and turn it back to you, Hetty.
Well, I might not let you completely leave it there, Annie, because
Okay.
I'm actually going to go into some of the Q&A and we can bring other folks back, but I'm going to stake on the health provider issue first. And Annie, since you're from Kaiser Permanente, you get to take first stack. I think there's a couple, and this is complex. In the Q&A, some of these issues are like my kids. So I guess it's about the partnerships with providers. So one question is a worry that actually sometimes the providers themselves give cover for absences and are writing excessive notes on absences. And what's the kind of partnership that can exist on helping that that isn't happening? And so let me just ask that question. Have you seen that issue? And do you know of any folks who've been able to tackle it?
I have heard about it, and it is not surprising. And I think much like we've had to educate our education community about the importance of school attendance, we've got to do that with our healthcare community as well. And we're behind on that. So we're starting to look at what are the ways that we can engage our pre-service training for providers to ensure that they're aware of the importance of school attendance and are really driving the messages home that both in their practice, but also in their messaging to the families that they're serving. I would also be remiss, Hetty, not to lift up the guidance that we co-created with you at Attendance Works around when to send students to school. Using best practices so just using that as a resource and making sure, frankly, that our own the pediatricians across the country are using that guidance to support their decision making.
By the way, Annie, fabulous. I did hear good news. AAP every year has an annual conference. Evidently, one of the plenaries on the annual conference is going to be on attendance, led by Dr. Heidi Schumacher. And I think there's two aspects, because I'm going to bring in one other aspect of this illness issue. There's making sure that kids don't unnecessarily miss school, but then there's also the issue of making sure kids get the supports they need for being in school. And like one comment in the chat was about how families miss a ton of time. And folks here might have some thoughts about that. How do you, either because they have to go a long ways to get a health services, but another concern has been when kids have real chronic illnesses. How do we kind of really make sure their issues and needs are being met? So I'm going to open this up both to you, Annie, but also to others. How do we kind of prevent, make sure that kids get the healthcare they need so that they're not missing so much school? And what are some of the strategies for doing that?
I think this is a complex and good question, Hetty. I think there's a movement to provide more care at schools. I saw a couple of folks in the chat referencing sort of telehealth and other types of healthcare in school settings that can be effective. Frankly, that's not available to everybody, and so we've got to work on access and sort of make sure there's no wrong door, right? That families are able to access health services they need, whether it's hopefully not during the school day, unless it's at school, but through the multiple venues that they can avail themselves of. So I think mobile clinics for more rural areas. I think there are different challenges that face different communities. certainly I think the healthcare is excited and ready to support ensuring that kids have the care they need to get to school every day.
And Eric, I would wonder, because you talked about also healthcare being some of the things, have you seen things that are particularly important about doing that? Like one of the things I've heard is that sometimes we don't avail ourselves, like school nurses can be this incredible link between the health providers, but also we don't always even involve school nurses on our attendance teams, so that we're integrating that in with our health strategy. Lessons learned from what you all have done in Bethlehem?
Yeah, yeah, we definitely try to put the message out there that our nurses are like the first ones that they should be contacting our parents, right? Like ask them questions. Like that's what they're there for. They have those relationships. Um, I'm not saying we're perfect in it, right? We have some of our nurses who have amazing relationships with all of their families. We have some that, you know, we're still working on. But you know, one of the important things that we also try to do is to also give that messaging to the primary care physicians of what we are looking for, right? So like, you know, something as simple as like make sure that when you are seeing that child, ask the parent like, how many days have they missed school this year, right? Just so that way everyone's talking about it. It's not just coming from the school. You know, and of course, like some of our well visits we do at school, but we've been really trying to communicate a lot with the PCPs and you know, and celebrating good attendance too, and having them help us to celebrate that.
One other thing I would just mention that I saw in the chat, maybe in the questions, we've also heard from partners, what schools need to invest in better ventilation systems. Like there are some things that we can do at schools that can just prevent the spread of illness, and our ability to kind of assess whether that's needed could also be an important thing. Yoli, I want to shift to you, or do you want to say something about health? Go ahead.
Well, it was a little bit general. Why don't you ask your question and I'll weave it in.
It was a question about the importance of early learning centers and Head Starts, and the fact that sometimes districts aren't actually talking about the importance of the early learning part. And so, you know, that then contributes to kids and families not necessarily understanding that the youngest learners need to be in school every day, and just whether you might have some insights about that issue.
Yeah, I think it goes to what I was going to frame a little bit earlier as you called on me, given the conversation about nurses and the importance of schools funding nurses. And what I was going to say is this really speaks to the kind of ongoing advocacy needed for adequately funding public education. So schools in California, for example, are, well, this is the before yesterday, because yesterday we got good news from our governor about the state budget. But districts across California were already making plans to cut. And usually nurses and librarians are the first to go.
Mm-hmm.
And this would have been a moment for us to remind leaders that if we are committed to addressing the chronic absence problems, we cannot keep cutting our way out of some of the best solutions. And that's similar to early learning. There's just inadequate investment in those early learning opportunities for children. We know that I think it's 10% of children who are eligible for Head Start actually get to be in Head Start. And that's obviously federal funding. And I think that, you know, when we don't invest, it also sends a message to families that it's not all that important. If just a few families get to have it, you know, and we know families, if they know what the richness and opportunity of being in an early learning program, a center-based quality, center-based care, et cetera, that they might likely embrace it. Obviously, not all parents. Some parents want to be home if they can with their little babies and their toddlers. But given the need to work, a lot of families are struggling with finding adequate and available, quality, affordable childcare. So I don't know if that answers your question, but it's the natural pipeline to pre-K, TK. In California, we have TK, transitional kinder, and kindergarten. And it's an opportunity for us to establish habits of daily attendance early so that once kids get into kinder and on, we hopefully would have already built those habits in.
Jill, anything you would add to this?
Yeah, I was going to add on, we have a focus in the early childhood realm as well. Actually, from birth to 5th grade, we have a pretty big push with the Talking is Teaching, Talk, Read, Sing campaign, and use that with partners in community to be reinforcing those habits that kiddos will need as they're bridging into kindergarten. And so some of this, I think what we've found is families don't know what they don't know about the expectations of coming into kindergarten. And it isn't kindergarten like when I went to kindergarten, right? And being able to have open and honest conversations around what the likelihood is of progressing successfully if you're missing X number of days versus if you're showing up every day are really powerful conversations to have. And so again, I think I would probably root most of the rest of my comments in data is king in these conversations. And if we can keep it simple, but keep it honest, folks seem to be responding to that message.
I want to also invite my partner in crime, Kwesi Rollins, if he is seeing anything in this very active chat that I will admit is challenging to monitor and observe while facilitating. Been trying to keep in the Q&A. Are there any questions, Kwesi, that you see burning that we really haven't been able to get to?
No, I think you guys did a wonderful job of addressing most of these issues. My reaction to some of the questions around HVAC systems is that in so many of our cities, schools are old. They don't have HVAC at all. They've got radiators and windows that open and close, and maybe air conditioners. So you've got, some of these issues around the physical plant. And Eric, you've been a principal. I don't know what the school situation is, the physical plant situation is in the schools in your district, but it's not unusual for principals and teachers not to really have a lot of control over the building specific issues. And yet that can be a contributing factor to kids not feeling safe or kids not feeling welcome or whatever. And so we also know that there are plenty of instances where teachers and staff and other folks find creative ways to still make old buildings feel warm, welcome, loving, etc. But so some of this is policy, and that extends to this issue of partnership.
So I want to then turn back to my colleagues and go to as you look to the future, especially we've got, glad to know the California budget situation is not so bad, Yoli, but we know federal funds, COVID relief dollars are, waning. We're all starting to feel that impact. So we got decreasing resources and a problem that certainly has not, is still pretty elevated. How do you think about moving forward in next steps in light of that challenging situation? And I invite anyone to go next if you want to offer up what some of your thoughts about the key next steps that you think you want to take in your own organization, your own community.
Yeah, I can kick us off. I'll say we're going to continue to follow all of the amazing resources that Attendance Works pushes out and bring into our community and share them out through our networks because they're really fantastic, relevant, timely resources that are practical for application. We're going to continue to invest in strategies that are showing improvements. And so we have seen a decrease from 29% in aggregate across our community schools to 20% in a year. And some of the schools had as high as 67% in the 21-22 school year. So, that kind of skewed the data. But we're seeing really good improvement. And so we're going to double down on some of those strategies around relationship building and some paid strategies around case management and things like that. We're also going to look at expanding our support through our AmeriCorps Vista program, our AmeriCorps programming. I think can't be underestimated if you have access to that resource. And then we're going to keep championing what's working and spotlighting the communities where we're seeing bright spots continue to emerge.
Eric, would you want to say, since we'll stick with Lehigh Valley for a second?
Yeah, I wanted to jump in right after that anyway. And I think, to Jill's points there, I think, for us, we're definitely going to keep talking about it, right? It's something that you can't go a day without bringing it up, because we can't let people forget that it's a huge issue and that we need kids there in order to learn. And when I say talking about it, of course, we have our messaging that we put out to our principals in our schools, to our teachers, where we're reminding them, if not weekly, at least, every bi-weekly of their data in their buildings, of their attendance data. But we're also trying to stem out a little bit farther to the community. So one thing that we're doing is we're kicking off a Did You Know attendance campaign. And basically this is, where we get information in the hands of all stakeholders, whether you're a teacher in the building, whether you are a city employee, whether you're the mailman, right? Or mail person. We are getting brochures out there, we're getting flyers, we're doing presentations. And we just want everyone to be able to talk about it, know why attendance is important. So when you see a student that's not in school, you start asking those questions. If your neighbor starts asking you, like, hey, how come you're not in school? How many days have you missed this year? All of a sudden everyone's paying attention to it, and that's what's going to start to make a difference. So if you know of any local celebrities who want to be in one of our Did You Know attendance videos, please send them my way.
Eric, that's certainly, if I do, I will. But I will just want to emphasize, it is everyone. And I just want to so applaud you on the outreach to teachers, because I think teachers see kids every day. That's the one given that we kind of have across our school systems. And I do want to mention, and we had the first webinar was about leveraging the role of teachers and the incredible role they can play. And in one of the districts that we went to, Livingston, what I thought about was I had the chance to go and heard some of the parents who had kids with health concerns. So the parent who had the kid with asthma, or the parent who had a kid with food allergies. And it wasn't just that they messaged attendance, but the parent with the asthma said, well, my teacher texts me when she's worried about my kid's cough. So in addition to them having a school nurse and having a school health plan, knowing that the teachers got her eye on, her baby, made her feel, I can send my kid to school. Or the parent with the allergies who said, well, my teacher sent me a note saying, well, if you're going to bring snacks to class, know that I have these kids with this allergy. So please careful. That knowing that your teacher cares about your kid and knows enough to be, is also about attendance every day. Because ultimately, this is about, do I trust my child with his adult? And if I trust them, I'll send them to school. Anyway, I just wanted to, attendance every day means lots of things. Annie or Yoli?
Yeah, I was just going to call out Victoria Franklin's slogan in England: attendance is everyone's responsibility. Love that. Thank you for sharing, Victoria. So my final share on this, Hetty, is what we will be doing together, including Attendance Works and PK, and Families in Schools, once we complete the focus groups. We're doing them across Northern California, Central, and we at Families in Schools are doing the ones in Los Angeles. And the reason for the focus groups was to help inform a statewide communication campaign, specifically around attendance in kindergarten, and specifically targeting Latino families. It is the largest population, and so just the numbers required us to focus, but hopefully we can expand the messages even beyond that. But as we think about those messages and this communication strategy, that, Hetty, I think is an opportunity for us to underscore and reframe the importance that schools play in the lives of children in a way that hopefully can address some of the funding issues now that we see the end of federal COVID dollars and the impact that that's going to have on schools. Because without the resources, we won't be able to sustain some of these really great ideas and bright spots and strategies that have resulted in bright spots. And so we will lift those up in our communication campaign. And this will be in the following year.
I so appreciate that, Yoli. And I think as we do, I'll just add us being really thoughtful about what are all the disciplines and the categories of funding that can contribute to this work. Is it our expanded learning program? Is it our family engagement programs? Is it our school-based health centers? Is it, and they don't always have the label of attendance on it. And yet we need them to support the work on attendance. Annie.
Yeah. A couple weeks ago, we did what we called a learning lab with a couple districts in Southern California, where we really looked at how to better integrate health and attendance. And it really was a bi-directional learning opportunity. We came in really to better understand the way these districts are thinking about health and attendance. And I thought we were going to walk out of the door with like 3 or 4 interventions that we all said, yes, this is really what works. But that is not what happened. What happened is we realized how siloed the health and attendance initiatives are in these school districts, and how much that undermines, especially in this fiscal environment, the work that each of them are doing, right? Because then everybody is at risk. And so, and in fact, we've already seen, unfortunately, some of those positions getting cut in those very same districts. So I think what we saw is this, and I hope we will start to work on in collaboration with all of you, is this idea of like, how do we, and I think it's the same thing, Yoli, that you've called out from the chat, is that an investment in health is an investment in attendance. An investment in teacher and staff well-being is an investment in attendance. That this is all really an ecosystem that we have to create around our schools, and that the more we silo it, and it's so hard and complicated to get everybody on the same page and in the same room, and I get it, it's not like it's there's a silver bullet, but that's, I think, what's really on my mind about next steps and how we can support this idea of integrating health and attendance in a more meaningful way.
All right. Before we turn to any just final resources, Kwesi, observations, thoughts, reflections, and that's also a cue for Pele to get those slides start to be ready to come back up.
Yeah, no, I think Annie's final point is the right point, which is to say that no one entity can do this alone. And in a time where major amounts of funds are expiring and there are budget cuts, you'd think that would be sufficient incentive for folks to work more closely together. And yet, not always, but I think those of us that have influence, those of us that have any kind of platform, those of us who are able to provide counsel, need to continue to just urge people to work more closely together, be more creative, partner. We can't get out of this. If you've got an HVAC issue, and you have an apprenticeship program, everybody that wants to be an HVAC person has to go through an apprenticeship. Maybe you can have a partnership with the HVAC companies to service your buildings that have HVAC. I mean, creativity solves a lot of problems. And so we've got to try everything that we haven't tried before, and then we've got to double down on the things that we know do work. Partnership does work. It's hard sometimes to sustain, but we have no choice. We have to figure out how to do a better job, because the schools can't do it by themselves. Local government can't do it by itself. The health groups can't do it by themselves, but working together, there's a lot of possibility. So,
and I want to just plug back in Jill's point earlier, and we can use data in real time, because many places have that, to say what is working and what's not. And then we modify and engage in continuous improvement all the time. We don't have the resources to invest in things that don't work right now.
Sure.
With that, let's show the slides just to give folks, make sure that you know of all the different resources you could be depending on or pulling upon. We have these qualitative data tools. So if you are not talking to young people and families and your staff, please leverage this to do that. Next slide. And make sure that this is the the guidance that we work together around keeping healthy. This is all in partnership with Kaiser Permanente, as well as the National Association of School Nurses. Next slide. In addition to the KIPS, this is the health guidance for going to school. You can also get the links are in the chat. Next slide. We also have information about anxiety to make sure that families understand when anxiety is an issue, because it's a really different solution. We got to keep kids showing up to school and address their anxiety, not just keep them home from school, because that's not going to change the situation. Next slide. And I also want to just make sure that you all keep thinking about these other local partners. This is from the National League of Cities, which really partnered with us starting last year about how do we get mayors and city leaders to the table so we can do this work. And there's also a why and engagement and attendance matters. So if you need to make the case to them, you have some of the resources for why they should be at the table with you. Next slide. And one way to bring them to the table can be around, as you move towards September Attendance Awareness Month, an awareness building strategy can actually be creating a proclamation so that you proclaim that and use that as an awareness building activity in your community. Next slide. And Kwesi, you want to say anything about your family engagement conference?
Well, in a couple of weeks, we'll be welcoming 5,000 of our closest friends and neighbors. There's still room if you want to come physically. If you can't come physically, sign up for our virtual package. We just released that this week. It's going to be wonderful.
And I will say there will be a pre-session on chronic absence, on family engagement and community schools. We'll be joined by A.L. Bergman, Karen Mapp, and we will talk a lot about how all of that needs to be woven together. Next slide. Just to remember, we have our attendance awareness website. Next slide. We have a Count Us In toolkit, so you can think about how to do this work in a timely way. Next slide. We also have all these other opportunities so folks realize that this attendance awareness campaign, which I think is now a thing officially, Kwesi, after we invented it, 12 years ago. That's the power of suggestion. And with that, I'm going to turn it back over to you.
All right, I think that's all. Thanks again to all of our wonderful panelists. The slides will be available within the next several days. For everyone, well, not the slides, but a copy of the webinar with the slides. So we want to thank you. Please fill out the survey. And I think that's the last slide. Special appreciation to our philanthropic partners, the Heising Simon Foundation, and all of our individual donors. And become an individual donor. It's not too late. You can do it easily.
And I would be remiss, we also have had the Overdeck Foundation investing in this. So thank you so much to Heising Simons and Overdeck that gives us the general support to do this along with all of our individual supporters.
Awesome. Thanks again, everyone. Thanks to all of our panelists. And see you at the number 3 webinar.
In August.
In August. Thank you, Hetty. I forgot.
Thank you, panelists. You were amazing. So appreciate it.
Yes. Wonderful. Take care, folks. Stay safe. See you in Atlanta.